I'm Wendy Everett, and I'm the founding president of NEHI. NEHI is a national health policy organization that began regionally in New England, but now we've expanded nationally and have offices here in San Francisco, in Washington, and in Cambridge. We look at innovation in healthcare that's directed to not only improving the quality of care, but also reducing its cost. Technology has the promise to be a very important innovation to enable us to practice better evidence-based medicine. So technology per se isn't the magic bullet, but it's an opportunity for us to overcome our human failings and have a systematic way to really improve the quality. If we improve the quality of healthcare, cost reduction generally follows. So for example, if we're able to help people manage severe chronic illnesses, such as congestive heart failure, at home, that prevents a very expensive hospitalization. One of the innovations that NEHI has looked at is tele-ICU. We worked with the University of Massachusetts Memorial Health Center and 2 community hospitals to evaluate both the improvement of quality and the reduction of cost using remote monitoring of patients in ICUs by critical care physicians. The results were beyond our wildest dreams, particularly in community hospitals. We were able to demonstrate that using tele-ICU or remote monitoring in the academic medical centers, they reduced mortality by 20%, they reduced their length of stay by 2 days, and they saved roughly $5,000 per case. The results were every bit as good in the community hospitals, and in one of those community hospitals, the physicians were not enthusiastic about this technology. There we were able to see a 30% reduction in mortality and about a 25% retention of patients who were able to be cared for in their community rather than having to be transferred to an academic medical center. This saves $10,000 per case, and it's wonderful for the patients and their families because they then don't have to travel. Some of the important barriers to the adoption of technology we've encountered in our technology initiative over the years. Certainly at the top of that list is the culture change that is required in order to get the full benefit from these technologies. Now, there's no denying that the introduction of one of these new technologies can be disruptive, it can be painful, it's a bear if you are trying to provide care and now you have to do things so dramatically differently. So a lot of times we'll get enormous resistance really to a change in the practice of medicine or a change in the practice of nursing care. People are used to doing things the way they were trained to do them. So this has really made us think about how do we go 1 or 2 levels down and change residency and medical school and nursing school and interdisciplinary education so that people are open to the idea of new technologies. A second critical barrier is often the cost. And the people in our hospitals are geared towards saying what is the upfront cost or the capital cost or the training cost. They haven't been given a very robust return on investment analysis that allows them to see and understand what the net benefit will be to them over time. So one of the things that NEHI always includes in the work that we do is to use PricewaterhouseCoopers or Deloitte or one of the outside good audit consulting firms to come in and look at both the cost of the capital acquisition of a technology or the implementation costs, and then to track that against the savings over a year or 2 years. That way, we're able to give really substantial and factual information to decision makers, and in some cases to policymakers who then can help us speed the adoption of these valuable innovations.